Hello everyone, I am Dr. Rukmani Choudhary and our today's topic is Myasthenia gravis. So in today's video, we will be discussing about Myasthenia gravis. So we will be covering Myasthenia gravis, like what is Myasthenia gravis, what are the causes for Myasthenia gravis, and what are the signs and symptoms, what all suffering you have while you have Myasthenia gravis. You can diagnose the diagnostic test. We will be discussing about different steps of the diagnosis. We will be covering treatment part. We will be discussing the allopathic part of treatment, the homeopathic part of treatment, and complication. If you don't treat this problem at the early stage, what complication you can have, what all complication you can. We will be discussing the management part, the lifestyle changes. So hopefully this video can help. Complete information, you are supposed to watch complete video. So let's start. So first we will be discussing about what is Myasthenia gravis. What is Myasthenia gravis? The definition. See, Myasthenia gravis. Myo means muscular, asthenia means asthenic means weakness. So this is neuromuscular disorder in which you have muscular weakness, muscular fatigue you can say, and this is neuromuscular autoimmune disorder. Autoimmune category. Autoimmune means see, we have immune system. Immune system is our defense system that fights for the foreign bodies, the foreign particles, and that protect us from the infection, any kind of bacterial viral infection. But in MG, in Myasthenia gravis, this is autoimmune. Auto means self destruction. So this is the kind of body mistakenly attacks the healthier tissue of its own. So this is the autoimmune disorder. Now we will be talking about the causes of Myasthenia gravis. See, if we talk about the causes means that what is the direct responsible thing. So there is no exact cause, there is no direct link. These are the theories, some theories that is believed that they can cause the Myasthenia gravis. So number one is the autoimmune. We already discussed the autoimmune disorder. So your body is not recognizing, your body is not differentiating, and your body is killing its own healthier tissue, and more specifically the healthier muscles fiber tissue. So there is a neuromuscular transmission. Normally we have the neuromuscular junction, and by the command of our nerve cells we get contraction and relaxation. But in MG cases there is a loss of neuromuscular coordination we call. So there is no contraction, there is no action. So there is a complete fatigue of the muscles, complete weakness of the muscles. So genetic also blamed for the Myasthenia gravis, genetics and autoimmune disorder. There is severe illness. If you have any bacterial viral infection, after severe illness, if you have severe illness, then you can have. And thymus gland also blamed for Myasthenia gravis, because in some cases of MG there is an increase, there is an enlargement of the size of the thymus gland, and there are tumor also seen in the cases of MG. So there can be thymus problem. So these are the causes that can lead to Myasthenia gravis. If we talk about the age part, see, if we talk about the age factor, the women, the lady that have Myasthenia gravis usually 40, and if we talk about the male patient, they have Myasthenia gravis after 60. So this is the variation they can have. And right, so the sign and symptoms. What are the sign and symptoms? What are the suffering you can have in Myasthenia gravis? See, in Myasthenia gravis, this is a neuromuscular disorder, autoimmune disorder. So this is the muscular disorder. So in muscular disorder, if we talk about, so there are the voluntary muscular weakness. Voluntary means under your control. So you lost that specifically. So there is, when you have trouble in trouble in speech, there is a speech problem, there is a difficult walking, difficult talking, difficult while speaking you have. And more specifically, if we talk about difficulty in swallowing, difficulty in breathing, so there is a dysphagia, there is this dyspnea, and muscular fatigue, muscular weakness. Obviously you have drooping of eyelid. The commonest symptom we find eyelid. So you have drooping, at times you have diplopia, double vision you can have. And sign and symptoms also varies from patient to patient, from the degree of the muscular weakness you have. Your sign and symptoms completely depend on that. And now we talk about the diagnosis, how we diagnose the Myasthenia gravis. See, there is a complete physical examination, complete neurological examination. Your nerve tests are done, your neurological tests are done, your some eye tests are done, or all reflexes tests are done to check, to diagnose. Your eye movements are checked, everything is checked completely, and certain blood tests are done, and there is a eyes test is also done. The eyes can be applied on the patient of MG and they respond well, so they start responding well after application of eyes. So this is the diagnostic test can be used. And if we talk about the CT scan and MRI, yes, CT scan and MRIs can be done. Chest CT scan and MRIs imaging test can be done to rule out any tumor, as we discussed in the causes, that there can be the tumor, there can be enlargement of the thymus gland. So this can be done. And EMG, there is a test, electromyography is also can be done. And now we talk about the management, the lifestyle changes. So see, this is the muscular problem, and this is aggravated while walking, while any kind of movement. So you are supposed to have plenty of rest, you are supposed to have, and this is also related with the stress. So you manage your stress, you are supposed to avoid your stress. So these are the lifestyle changes you can make to have a better life. And if we talk about the treatment part, if we talk about, we will talk about the allopathic treatment and the homeopathic treatment. See, if we talk about the allopathic treatment, there are the short use. This is, see, in the cases of MG, there are relapses, there are remissions, means you have, at times you have problem, at times you don't have any problem. So this is depend on the complete case, complete symptom. So corticosteroids can be given, corticosteroids and thymus gland removal. In some cases, thymus gland removed, and it is seen that the patient start responding well after removal of the thymus gland. So thymus gland can, and plasma exchange. See, you have, this is an autoimmune disorder and you have unhealthy antibodies. So there are removal of the unhealthy antibodies and you start responding well. And one more thing is done, IV immunoglobulins. So you are injected immunoglobulins, healthy immunoglobulins, so you start responding well, having fine. So these are the allopathic part of treatment. Now we will be discussing about homeopathic part of treatment, homeopathic medicine for the MG cases, Myasthenia gravis. See, if you are willing to take homeopathic medicine, why to take homeopathic medicine? See, homeopathic medicine, there are the problem in your nervous system, neuromuscular problem, autoimmune problem, and there is a progression of the disease. So homeopathy will help you to control the disease, to control the progression of the disease. Homeopathy will help you, and homeopathy is basically focused on the immune system. So you are having fault in your immune system, so homeopathy rectifies, homeopathy correct that, and homeopathy boost your immune system. So ultimately you get better results. And there are some tonic, there are some nerve tonic, there are some muscular tonic, and there are some immune tonics. So you can use those tonics to get relief. We will be discussing medicine one by one. We are having medicine, so we will be discussing medicine. So first of all, we will be discussing about Arnica montana. See, Arnica montana is the medicine. You just wherever you belong, doesn't matter, you just focus on the medicine name, you don't focus on the medicine company. So this is the main thing you are supposed to focus. Arnica montana, 30 or 200 power, you are supposed to take this medicine. This is the muscular tonic in homeopathy. Improvement in your muscular tone, muscle strength. This gives you muscular strength. So you are supposed to take 2 to 3 drops. This is the dropper you are supposed to take directly. 2 to 3 drops orally twice or thrice in a day before meal. You are supposed to take this medicine before meal, and you are supposed to take minimum for 2 to 3 weeks. And once you start responding, you can lower down, you can decrease the doses of the medicine. And if you are not responding, you can continue the treatment. It takes time in homeopathy. You are supposed to use medicine on the regular basis. Regularly you are supposed to use medicine. We will be discussing about Baryta Carb. See, this is again the homeopathy medicine, Baryta Carb, 30 or 200 power. If you are starting your treatment on your own, you can take your medicine in lower potency. So 30 or 200 you can start. So this is again having dropper. So you are supposed to take 2 to 3 drops orally twice or thrice before meal, regularly for 4 to 6 weeks, 4 to 10 weeks, depending how soon you start responding to your case. So this is the medicine. Baryta Carb is given when there is a muscles are not developed enough. There is a muscular underdeveloped muscles. If we talk about the muscles are underdeveloped at puberty age, so this help you in the development of the muscular structure, muscular development. You can take Baryta Carb. again, but you're supposed to use one medicine at a time. One medicine you are supposed to use. And if you are watching on our YouTube channel, you can find link below. Link is given in the description box, and you are supposed to use one medicine at a time depending on your case, that what all symptom you are having. You're supposed to use medicine on the basis of that. Now we will be discussing about Bryonia alba. See, Bryonia alba is again the homeopathic medicine, and Bryonia alba is given when the patient suffering is aggravated by motion, when in the symptom that you have problem while walking, difficult walking, aggravation by walking. So the keynote symptom of medicine also that aggravation motion, when you have problem while walking, and in mg there is the same symptom. So you can use Bryonia alba 30 power, 30 or 200 power, 2 to 3 drops orally twice or thrice daily before meal, or 2 to 3 weeks depending again that how well you start responding, how soon you start responding with the case. We are having Gelsemium. Gelsemium again the homeopathic medicine, Gelsemium 30 or 200 power. See, Gelsemium in homeopathy is the when there is a complete relaxation of the muscle, there is no contraction, there is no movement at all. So Gelsemium is the medicine. In Gelsemium we have 3D, the dizziness, drowsiness and dullness. So this is again the muscular tonic. You can use Gelsemium if you are having dullness, dizziness, drowsiness and there is no movement. So again Gelsemium, the 2 to 3 drops twice or thrice daily before meal. You can continue 2 to 3 weeks, or depending how well, how soon you are responding with the medicine. Again, last medicine we are having Plumbum Med. So this is the Plumbum Med. Plumbum Med is given when there is a shortness, when there is atrophy, dystrophy of the muscle. So you can use Plumbum Med again with the help of dropper, 2 drops, 2 to 3 4 depending on your case. And if you are having problem while having direct drop on your tongue, you can mix in the lukewarm water 1 or 2 tablespoons of water. You can mix the medicine 2 to 3 drops, and you can have twice or thrice before meal orally, 4 to 6 weeks, 4 to 8 weeks depending. In homeopathy there is a regularity you are supposed to maintain with the homeopathic medicine. So hopefully this video can help you. If you find this video helpful, please like this video. You can share this video with your family member and relatives, and you don't forget to subscribe our channel to get updated. So thank you for watching. Thank you so much. And if you are watching on YouTube, there are the end screen given on the end of the video. You can press on them for the detailed information. Thank you so much. Thank you for watching.